We are live.
Hello, am I audible?
Yes, sir.
Good evening, fellow colleagues, ladies, gentlemen. We are
Dr.
here
Raheja,
today.
we'll just take a minute and we'll just wait for a few seconds. I think we'll wait for the participants. They're just building up.
Perfect,
So
perfect.
you can take a little break for just a few seconds.
Sure.
So good evening, everyone. Namaskar. On behalf of the Delhi State Chapter of IRIA, it's my proud privilege to invite you today for this Delhi Masterclass. This is the fourth Masterclass in the COVID series. And this is, according to me, the most important of the classes because we are dealing with a topic which is not talked about so much or was not talked about so much earlier. Mental health. We have all been stressed as workers and as people, as individuals. We have lost family, friends, and colleagues. And I think we are required to be counseled by the experts. And we have a very exciting team today of the top psychiatrists and one of our own radiologists who will teach us mind management. I hand over now to my colleague, Dr. Raheja Jain. Dr. Raheja Jain is Joint Secretary of Delhi State Chapter of IRIA. He has also been faculty at Maulana Azad Medical College, and he is president of the NGO Doctors for You. Dr. Rajat has played a stellar role in managing COVID during the last 1.5 years. He's opened 38 hospitals and helped countless people fight this disease. I hand over now to my colleague and friend, Dr. Rajat Jain. Rajat.
Thank you, ma'am. It's a great honor to be a part of this masterclass and a very, very thoughtful topic, specifically in the COVID time. Now, we all know that COVID has not just affected us physically, but in a very, very big way, mentally. Working in the COVID area and managing these makeshift hospital and interacting with presently more than 1,000 doctors who are working in these COVID areas, I can tell you that the kind of stress through which that the doctors are going, specifically those who are working in the COVID area, cannot be described in words. The same is the status with the patients. We are getting a lot of patients who are coming back, who have been recovered from the COVID with different sort of mental issues. So I think this is a very, very well thought of topic by Delhi State Chapter of IRIA. And I don't think there could be a better person than Dr. Deepak Raheja, who needs no introduction. He's a senior psychiatrist and psychotherapist associated with the field of mental health for over a decade. He uses an eclectic healing approach, combining the medical aspect with a rich experience of hypnotherapy, spiritual counseling, and alternate healing practices. Dr. Deepak Raheja is a philanthropist and continuously strives for the cause of mentally ill on the streets and the psychological and basic upkeep aspect of the street children. He currently heads the Department of Psychiatry at Paras Hospital, Sama Nursing Home, and Ashlok Hospital. It's great honor to have you here, sir. So now he will be speaking about mental health in the COVID. Over to you, sir.
Dr. Rajat, thank you very much for a very extravagant introduction. Dr. Anjali Prakash, Dr. Sangeeta Saxena, Dr. Atin, Dr. Shivani Mehra, and not to mention my dear friend, Dr. Shalini Thapar, for inviting me and having me here today. I'm going to talk about mental health in these times. I'm going to start with a small, not a vignette, but a incident that happened. A friend of mine who works in one of the hospital, and for reasons of confidentiality, I will not name the hospital, working in the COVID emergency team, receives the patient.
Sir, can you be slightly louder? Your voice is slightly on the lower side.
Let me just see if I have the earbuds right. Is it better?
Yes, it's much better, sir. Thank you.
He receives a patient in the hospital at the ER, a patient of COVID, an old man brought by the son, and the father was traveling in the boot of the car. The fear that what if I contract the infection? Now, he is not an isolated example. When the pandemic became, known to all of us, and with lesser amount that we knew about the virus and the pandemic, we all became extremely fearful of what was going to happen next. Now, if the fear response or the PTSD was going to follow, I mean, a lot of people have spoken about a psychiatric pandemic or a mental health issue pandemic that may follow the current pandemic or an epidemic within the pandemic. For a long time, we believed that the incidence of psychiatric morbidity was perhaps lesser in our country compared to the West, and the outcome was better. And the reason that we cited, of course, for a poor socioeconomic strata and per capita income, but the reasons that we cited were that we were a more resilient culture. The factors that attribute to resilience, like family units, joint families, support from friends and neighbors, was robust and far more available to us than was available to people in the West. So for a long time, we felt that PTSD, which is post-traumatic stress disorder, or stress per se, in the aftermath of a pandemic or an epidemic, was perhaps a myth in our country. It was not going to be so bad. We were going to be more resilient. But in our culture, we saw that the usual expression of mental illness, which came in the form of either domestic violence or increased somatization, increased use of substances and alcohol dependence, all of these things started abounding. And because I'm a psychiatrist in clinical practice, we did see that there was a hugely increased incidence of people grappling with mental health issues. And we saw a very nice, interesting paradox phenomena where we saw that patients of stress disorder kind of stabilized because they felt that society now was more sensitive to what they were going through, and they were not alone battling the stress or the anxiety. So their symptoms kind of began to stabilize, because one of the key issue that a person suffering from mental illness grapples with is the stigma associated with it. For a long time, we've all over the world dealt with an anti-psychiatry movement. हमारे ही colleagues आज से 20 साल पहले कहा करते थे कि 4 बीमारियां 4 दवाएं, ये दवाएं तो हम भी लिख सकते हैं, तो psychiatrist क्या करेगा? ये माना जाता था that people who were going to a psychiatrist were possibly unwell, and they were colloquial words like they were mentally insane or they had lost it. So a whole lot of that burden of treatment was shared by colleagues from internal medicine and general physicians. Rightfully so, because for a country of this population, the magnitude of population that we have here, the counted number of mental health professionals that we have available would not be able to take care of the huge issue. So one of the key challenges or key competitors of treating not professionals, treating individuals that we dealt with was spiritual healers, babas, tantrics, half-baked, practitioners of ancient system of medicines. All of them put together would be able to attract a sizable number of patients of mental illness, because patients had less faith and courage because of stigma to go and see a doctor. And to some extent, I think that stigma was reinforced by our own medical fraternity because of either willingness to accept that mental illness was so real. Now, in all the discussions, panel discussions that we've seen in the last 2 years post the pandemic, most of our colleagues, including your own good self, whenever you've had the opportunity to be on panel discussions, have clearly emphasize that people with a positive mindset had a better ability, were able to evoke a better immune mechanism and immune response post the infection, and were able to deal with the viral affliction in a much more stable and better way. We kept saying, be strong, because we realized, and this was not just psychiatrist or mental health practitioner, it was specialists from all walks of medical fraternity, pulmonologists, endocrinologists, radiologists like yourself, who came on televisions, on chat shows, and said we need to be strong, because people who were not strong possibly had a flurry of an interleukin explosion, which led to a more devastating effect of the virus. The virus per se has issues pertaining to fear, issues pertaining to anxiety, the issues that people have grappled with, including my fear is so real in terms of what if I'm next? Will I get the right support? So, one of the three key features of a pandemic, which is and which is something very unique that we've seen in this particular pandemic, which is it has been catastrophic, it has been cumulative, and it has been very, very continuous. So people dealt with the first wave. The alpha variant was evidently the infectivity was not so high. The damages that happened were not so high. People started getting into the fight mode, dealt with it, emerged from it, only to deal with the current Delta variant, which had such hugely devastating effect, where when we all know that when one individual got infected in the family, perhaps everybody got infected. When we saw one death in a family, and this possibly is a genetic underlying denominator, which perhaps will eventually be able to explain this better, that when there was one death in the family, there was a subsequent death. In this pandemic itself, we saw that children, a huge number, lost both their parents or one of their parents. For families and individuals who've lost people, things are never going to come back to be the same again. But for most of us, so there have been some of us who were very severely ill, had severe symptoms. There were some of us who unfortunately needed to go to a hospital. And there were certainly then some of unfortunate of us who needed to go to an ICU, who needed to be intubated, but came out, emerged alive, and who are amongst us. But the avoidance that we see there in terms of the whole the spiel and the talk about the pandemic is characteristic and pathognomic of the post-traumatic syndrome that we see in individuals who have been exposed to a hugely disastrous situation. There have been some of these who perhaps went to deteriorate as bad as having almost like a near-death experience. And these are then individuals who've come back and who are dealing with anxieties, who are dealing with depressions, who've in form of avoidance are not indulging into any talk vis-a-vis the pandemic or COVID-19. They are not wanting to see the news, because any event or any thing that is associated with COVID-19 works like a cue to evoke the fight or flight response. And here it is the hyperactive response, which is characterized by the sympathetic stimulation. So if we really look at our brain and try and understand what is happening, and essentially what we'll understand is that amongst the brain stem, as it goes up, among broader covering of the cerebral cortex, if we really look at the limbic system to be the mechanism which is like a guarding mechanism, which is something that is holding the key like a radar to see if something has gone wrong. So if somebody touches my car, there is an alarm there which ticks off, and I know somebody is trying to tamper with it. If there is a tiger that comes to attack me, then at that moment the limbic system, which stores the memory of my security, tells me that the tiger is going to eat me up, and immediately that is to take over and to do whatever it can to protect me. Now, for most of us who have been exposed to the pandemic vis-a-vis a vicarious traumatization. And what is vicarious traumatization? It is a traumatization that all of us have been exposed to by virtue of being around a situation which is life threatening, which is disastrous, which is catastrophic, which has been cumulative. And unfortunately, unlike the other pandemics in the recent year, like the Middle Eastern respiratory syndrome or the SARS, I mean, we've known this to be way longer. And because this is way longer and we are dealing still with ambiguity, I mean, today's newspaper talks a lot about the third wave because none of us now wants to be taken by surprise. We all heard the story of, not the story, the real life example tragedy of a young colleague of ours who was working in the Max Hospital. I'm not reaching confidentiality because it was all over in the newspaper, who was working in the COVID ward. And just by the sheer frustration of doing what he was doing night and day, trying to be the heroic participant in this whole scenario, trying to save life. And when you find that you are not adequate enough, it led to the trauma, which was so significant, so severe, that he decided to end his life. He committed suicide and he died and left behind a young wife. He'd been recently married, who was pregnant. So imagine the trauma that we go through. So if somebody asks me, how are you? My first response is, I'm fine. Which is natural, which is built into us because we don't like to show to the world beyond a certain few, and sometimes not even those certain few, because socially we have been programmed and engineered to say that you are fine. But when you probe a little bit further, and I must say that when we talk about the frontline workers, the doctors who are directly exposed to the COVID situation, I would include the radiologists who played a very pivotal role, because none of the diagnosis got completed without the HRCT. None of the so we relied upon you, and you were being bombarded with questions related to the COVID-19, to what the lungs look like. My RT-PCR is negative. Do I still have COVID? People came up with issues. So we were exposed to situation. We were expected to be invincible. We were expected to play the heroic role, as is expected in a war. Soldier goes to fight. But amidst that, the vulnerability that we harbored, the challenges that we all dealt with when we went out through the day trying to heroically see patients, and then come back with the fear, if you were possibly bringing the virus back home. What if you ended up infecting your old mother or your old father or your very young children? Just that sheer thought, जिसे हिंदी में ताना बाना कहा जाता है, was capable of producing cognitive dissonance, which was so severe that I would say that now a lot of studies are emerging from all over the world, including premier institutes in India, like All India Institute or NIMHANS, which are, or IBHAS, which are categorically talking about a very highly increased incidence and prevalence of PTSD, of anxiety disorders, of stress-related disorders. People have, if you look at Google searches in the last 1.5 years, the searches pertaining to anxiety, searches pertaining to depression, mild, moderate, severe of any kind, they have really skyrocketed. So we have constantly lived in an environment where we are baffled. We didn't really know how to look after our mental health. We didn't really have faith. We didn't really think the medication route was the right route. I mean, if therapy really helped, but all our colleagues, I would not say most of our colleagues, all our colleagues in psychiatry have been constantly speaking to doctors, to nurses, to frontline workers, to paramedics who've dealt with extreme amount of ambiguity. One of the key factor which is instrumental in determining the outcome of any challenge is the kind of support that you have available. And unfortunately, in this situation, what's available to the bleakest is the support. Your family is not allowed to be with you. You go into isolation. And all of us, most of us, unfortunately, the virus would have interfaced with 70% of us in one form or the other. Just those 10 days, 12 days, 14 days of sheer isolation, of grappling. And unfortunately, the ones who got affected much earlier dealt with more trauma because there's 1 gram possibly of virus which is invisible, which we knew very little about. We are in the process of understanding the treatment protocols are changing, when to use steroids, if remdesivir has a role, if tozi has a role, if it's empirical, would plasma therapy work or not work, with people all around having opinions, having thoughts and ideas. But what does it lead and leave a normal mind with? Extreme amount of ambiguity, extreme amount of chaos, extreme amount of dissonance, with little mechanism in terms of how to be able to deal with it. How much of news is right? How much should I know? If trauma is happening around, is the knowledge about that trauma? In the second wave, just this sheer chaos that happened because of non-availability of hospital beds. All hospital beds were full. All high courts, Supreme Courts talking about oxygen unavailability, people dying in hospitals because of lack of oxygen availability, is extremely traumatic to a normal human mind. When you have a close family who is lying in a hospital ICU and whom you are counting because the television is transmitting to tell you that this particular hospital has only an hour left of oxygen supply, and if not replenished, if not reinstated, the patients may die. Imagine you've got a family who's right there. You managed to get a hospital bed, and what you needed to do. For someone like me, and like a lot of us who were bombarded with calls from friends and families who went all out to try and muster resources, to try and help them get hospital beds with help of colleagues like yours, often eventually at least letting that thought cross my mind. And because I feel I'm a mental health practitioner, I'm a psychiatrist, I possibly was able to deal with that thought. And that thought being that I have exhausted all, or I'm exhausting most of my resources to get these things and these needs for my friends who are dying. What if something happens to me? What if something happens to my family? Will my call be answered? Can I really go back to Dr. Shalini Thapar and ask her that I need another bed, or I need more support for a family? Will she still be there? Because the resources were limited, and unfortunately, we as doctors had not as much access to those resources, because the resources also were shared by bureaucracy, by politics, by hospital administration. So we just weren't the either the sole deciders or the sole benefactors. So we had to compromise by pushing and often getting no for an answer. But I think all of us tried. We went through, and I think one of the key resilience imparting factor during this time that I feel really helped people were people who were being able to go beyond themselves, who became altruistic, who decided to help. Because when you decided to help, you were not sitting, you were not ruminating, you were also feeling like a part of be part of the solution, rather than just seeing the problems abound around you. So you went all out. You spoke to friends, families, hospitals, friends who owned hospitals, trying to help others. And when we did that, we saw different absolutely different category of young warriors who emerged I mean, I have a young daughter who initiated and became a part of an NGO. And I saw this group of 15 year to 20 years who were having sleepless nights for like weeks together, trying to verify leads, trying to find hospital beds, speak to people, get medicines and muster them. And it was like an amazing enthusiasm. And you didn't see a speck of anxiety or a speck. I mean, I'm sure we're all fearful, so were they. But the whole mechanism that was utilized to try and be a part of the solution was so therapeutic that these were young kids who emerged so much stronger. You saw religious groups, you saw our friends who were trying to be a part of the solution. So I would definitely think that people have had serious mental health issues, which have increased. The prominent of them being anxieties, stress related disorders, people who had vulnerability to depressive symptoms became more, the symptoms became more accentuated, and they had I mean, also people who had physical ailments. I mean, this was a wrong time for anyone to even fall sick because the resources and the doctors were limited. I think the whole facade and the process of seeing a doctor across with visor and with the PPE can by itself be an extremely anxiogenic experience for most people, something that all of us are not used to. I mean, these are definitely unprecedented times which have proven to be extremely challenging, and people have really grappled. I'm not really undermining the resilience of the human mind, and I think it is very important that if you look at the corrective mechanism, which my subsequent speaker, Dr. Saxena, is going to talk about. But if we really look at mechanisms that help people recover, you take a top-down approach or you take a bottom-up approach. In the top-down approach, you work on the mind, you work on the brain, you work on the neurochemistry to correct that so people become more resilient, more stronger, and if they're already having the symptoms, to be able to deal and cope with them and recover faster. In the bottom-up approach, you try and bring about behavioral changes which will eventually then mediate through the neurochemical process to bring about the desired improvement in symptoms. And I think if we just take an example of both, um, mindfulness, which my subsequent speaker, who's an expert and who has, I'm told, a very in-depth knowledge of the subject, will talk about. But meditation, mindfulness technique, and when I talk about mindfulness, I definitely want to emphasize here that mindfulness should actually be equated with what is called as momentfulness, which means the ability to be able to connect to the present moment, to understand that if I can be in the present moment, my ability to not worry about the past, which is a baggage I carry, or to worry about the future, which is ambiguity. I do not know what it'll be about, but just that worry that complicates my thinking process and then complicates the neurochemistry in the various circuits, including the monoamine circuit. It fluctuates it in a manner where my brain and the mind ceases to be in an equilibrium, evoking a very dysfunctional kind of immune response, making me vulnerable to various pathologies, where various complications that might affect that might come in when an individual is affected with the virus. So I think it is very important that we try and keep it simple. It is important that we meditate. It is important that we take this time to introspect. I'm going to more or less, I think my time is finishing. So I will wrap up by just one example. And that example being very pertinent because I think demonetization was a very unique phenomena that our generation got exposed to. And what really happened in demonetization, money, something that we value so much, suddenly lost all its power. we needed and waited to get rid of our money, to spend it, to fill fuel, to give it to people, to exchange it. The money suddenly ceased to have the power that it had. The second major unique phenomena that all of us have been exposed to is this pandemic. It's once in a century. I mean, we've known pandemics and pandemics have been there. They will come, right from the bubonic plague to where we are. And if we are living in a world of this biological transformation of various pathogens, then we might really have to deal with challenges. So if the demonetization did not change your relationship with the material world, and if the current pandemic has not changed your relationship with life, then I think we really need to introspect कि क्या हम सही राह पे हैं, क्या हम इंट्रोस्पेक्ट करने के लिए तैयार हैं. मतलब हमने मंदिर मांगे, मस्जिद मांगी, हमने बड़े-बड़े, लेकिन हमने कभी अस्पताल नहीं मांगे, हम कभी अपने डॉक्टर्स को वैल्यू नहीं कर पाए. हमने ये देखा कि paranoia is a trait of emerging society. So we took many folds ahead and possibly copied some of the Western model to include the noble profession of a doctor-patient relationship into the consumer protection ambit, only to realize that if we value somebody who selflessly, and I think all doctors have really taken up the challenge and actually in this pandemic stood like the warriors. And I think if this is not fighting for the nation, if this is not fighting truly for the emancipation and protection of the humanity, then what is? So I think with that, I will lead you all to introspect, to be more mindful, to be in the present moment, so we can all deal with the challenges. We do not know what the future challenges will be, but I think we will be able to deal in a more cohesive way if we are collected, calm, and have better coping skills. Thank you very much. Thank you.
Yeah, thank you very much, sir, for the beautiful insight. And we will take the questions at the end. Now I will invite Dr. Sangeeta Saxena, a senior professor and head of the Department of Radiodiagnosis at Government Medical College Kota. Ma'am will be speaking on a topic which I feel that a lot of us need to know, and that is mind management, how and why. I am personally looking on this particular topic. Ma'am is a senior professor and head of the department, and she believes in keeping a calm mind with the help of meditation and deep breathing exercises. She suggests pranayam for strengthening your lung and increasing their capacity. She promotes these practices for positivity within and your surrounding. For those who are not aware, she is the senior faculty at Art of Living. So a lot to learn from you, ma'am. Over to you.
Thank you so much, Rajat. Thank you, Delhi IRA chapter, Dr. Shivani, Dr. Alka, Dr. Shalini, Dr. Rajat, and Dr. Atin, and all the office bearers of the Delhi chapter of IRA for giving me this opportunity to speak on this topic. It's such a challenging topic. I really love to speak on this. I've been a meditator since 2004 or before that. So I think I'll be able to do justice with the topic. Let's see. Topic is mind management, how and why. So before starting the mind management, we should see how much how our existence is. See, we have 7 layers of our existence. If we go from the gross to the subtle level, we have body, etc. To that is breath, then mind and its faculties like intellect, memory, ego, and ultimately we have the self. These are the 7 layers of our existence. If we see that breath has got bearing on the mind-body complex, if we take mind and its faculties in one, that is mind, intellect, memory, and ego as the mind, and mind-body complex has a bearing on the breath has a bearing on this mind-body complex and the self also. So self is beyond the ego, beyond this mind and its faculties. If we see how we are getting energy, what are the sources of energy, they are more four important sources of energy for our existences. One is naturally the food. We should know what type of food and we should take. Everybody knows what are the sattvic, tamasic, and rajasic food are. Then we should take the adequate amount of sleep. Breath is the most important, and I'm sorry to state, it's the most neglected source of energy. We all are doctors. We know that in the fetal life, when the lungs are non-functional, and as soon as the baby is out of the womb of the mother, he or she takes the first breath. He or she tries to inflate the lungs fully. The respiration is abdominothoracic. But as we grow old, the breathing becomes shallow and shallow. And we used to breathe at the level of thorax. Thoracic breathing remains. Our capacity, one of my pulmonologist friend, he told me yesterday only that one lung has a capacity of 2.5 to 3 liters, and we are just inhaling and exhaling only 500 to 600 ml. See how much of the reserves are being wasted. So we have to take an account about the breath. Last and the very important source of energy is the meditative calm and serene mental state with clarity and pinpoint focus sharpness. These are the main sources of energy for our existence. Yes, I told you earlier that does the breath has some bearing on the mind? Yes. Breathing is happening you see, the breathing is happening in the present moment. It is the link between our outer environment to the inner world of silence. And with the moderation of the breath, we can affect the mind as well as the emotions. If you see, there are different patterns of the breath. Once you are depressed or anxious or tense, the breathing is very shallow kinds. When you are angry, you must have noticed our breathing. We used to breathe very fast. And at this moment, you are sitting normally and the breathing is happening normally. So for healthy breathing, it harmonizes the emotions. It was well known by our ancient people, and they used to use these breathing exercises in the past also. I should say quality of breath is directly proportional to the quality of your life. But we have taken breath as for the granted. We are not using our lungs up to its 30% capacity. See, if you ask me, kite is like a mind, and the thread which is being given to the kite is your breath. When longer the thread means longer and deeper the breath, the steadier will be the kite in the sky, high up in the sky. So if you want to keep your mind stable or steady, we have to adjust to the breath. This is the power of the breath. So mind is always an enigma since ages. Buddha also teaches if one man conquers in battle, 1,000 men, 1,000 times, and if another person himself, if another person conquer himself, that means the later one is the greater conqueror. Means one who conquers his mind is the better conqueror, is the winner. So managing and controlling the minds are the most difficult task, but I should say it is not an impossible task. Nothing in life is more than one's own mind. Before going to the properties of mind, see, if you know the nature or the properties of fire, you can play with the fire. But if you are not knowing the properties of fire, it will burn you. Same principle applies to the mind also. If you know the properties of mind, you can play with the mind. So the most important property, as my previous speaker rightly said, it oscillates between past and future. Dr. Raheja told us that it goes to the past, sometimes it goes to the future. Whenever it goes to the past, we are in guilt or frustration. And once it goes to the future, we are not aware of what is going to happen next. So it is connected with emotions like fear and anxiety, but it seldom stays in the present, which is the seat of happiness. So past brings tears, future brings fears, and the present brings cheers. Second property, the important property of mind is, if I give you 10 compliments and if I give you 10 insults, our mind will carry these 2 insults. This is a very important thing. It clings towards the negativity. And third important property is, whatever you resist, it will persist. Shall we do a small experiment on ourselves? Wherever you are sitting, just close your eyes and breathe in. एक लंबी सांस ले और छोड़ दे. Again, a breath in and out. You can imagine anything on this world. But आप एक काले मुंह के बंदर के बारे में बिल्कुल भी मत सोचिए. एक काले मुंह का बंदर एक पेड़ से दूसरे पेड़ पे छलांगे लगा रहा है. इस काले मुंह के बंदर के बारे में बिल्कुल भी ना सोचे. कुछ भी सोच सकते हैं, लेकिन इस काले मुंह के बंदर के बारे में नहीं सोचेंगे. Just open your eyes. See, everybody must be having this kale mukha bandar. Yes, this is the property of the mind. Whatever you resist, it will persist. आप सोचते हो ना, आज इस व्यक्ति का तो ध्यान आए नहीं दिन भर, और वही व्यक्ति, he or she resides in your mind the entire day. Yes, there are two different principles for body and mind. For body, effort is the language. For mind, effortlessness is the language. We'll see further in our talk. So you all know that law of attraction, that means wherever your mind goes, it will grow. If it will go to the abundance will grow. If mind goes to the lack will grow. So when we are in positive frame of mind, we will attract the same kind of people. If we are negative, we will attract the negative people. Same. If we are if we are in a complaining mode, the people around us will also be in the complaining mode. So how the memory or the works? This is the 5 senses. You know what 5 senses we have, and we have the object of senses. When they got together, we used to have life experiences. The experiences may be pleasant or it may be unpleasant. When they are pleasant, we want to have more and more. Yes, this leads to craving. But when the unpleasant experiences are there, the mind resists. It should not happen again. It should not happen again. The aversion comes and it will lead to misery. Similarly, when there are cravings, we have repeated thoughts, and these thoughts causes desires to happen. When the desire is fulfilled, we have more and more desires. Again, it leads to misery. When the desires are unfulfilled, again it leads to misery. So sensory pleasures, ultimately they give misery. The pleasure which is derived from the sensory objects, it may be of limited period, because there is a beginning as well as an end. It cannot be on the continuous process. There is a beginning as well as end. Therefore, sustained pleasure cannot be obtained from the sensory objects. So what type of our existence should be? Our body should be disease-free. We should have a quiver-free breath. Our mind should be confusion-free. Intellect should be inhibition-free. And our memory should be trauma-free. Very important. See, most of the time, what we used to store in our memory or in chitta is usually the negative events, negative experiences, and negative events and experiences associated with those events, emotions associated with those events. And an ego, it should not constrain, but which encompasses everyone. What Sri Ravi Shankar says, existence should be like this. So what is the power of mind management? See, a lot has been talked about mind, and so though it is very difficult to control or manage a mind, but I should say it's not impossible. By practice, by dispassion, one can manage one's mind. So what are the benefits? It increases one's productivity in all walks of life. May it be the workplace, your relations, your spiritual life, whatever it is. we see the productivity enhancement in each walk of life. It develops abundant energy and great enthusiasm. There is a multidimensional understanding of a person or situation. It increases awareness, it increases alertness, it increases belongingness, which is very important, and it increases the commitment and compassion to others. So, how to manage one's mind, our own mind? In Patanjali Yoga Sutra, it is said, Yoga Chitta Vritti Nirodha. That means yoga is not merely the asanas we are performing, it is making our mind to go inward from object to subject, from object to self. This is the entire yoga. Need to pay attention to the breath. As I said earlier, our breath is like a thread given to the kite, and kite is the mind. By increasing the depth of the breath, we can make our mind stable. So we can do certain pranayams on daily basis like Brahmari, the Nadi Shodhan pranayam, alternate nostril breathings, Kapalbhati, Bhastrika, 3-stage pranayam, and very important, deep breathing exercises like Sudarshan Kriya. This is a rhythmic breathing exercise which brings the person into the present moment. See, I told you, we have 7 layers of existence, and these 7 layers of existence have their own rhythms. And when there is synchrony or symphony between all the rhythms, there will not be a stress. But suppose all these 7 layers, there is no symphony, there is no synchronization, there will be loud noise. That noise is known as stress. So what Sudarshan Kriya does is, it brings out the resonance between all these rhythms of your life. So it's a beautiful breathing exercise which brings you in the present moment, which relieves you from the stresses of the life. And lastly, but not the least, is the meditation. Meditation is, as my previous speaker, Dr. Deepak said, it is the process by which you bring your mind into the present. Present moment is so vast. And if you have lived the present moment fully, your past will be good and future going to be really good. So meditation it is a conscious experience of that aspect of the being that enriches, that energizes all the 6 layers. And I should say this is the need of the hour at this time when the post-COVID stresses are so profound. We need to do meditation at least twice a day. When mind becomes calm, there will be peace in and around, within you and in your surroundings also. So automatically joy and happiness will be there. Once you are happy, you make others happy. So it enhances the positivity. It spreads the positivity not within you, but around you also. It enhances the clarity. Your focus becomes pinpoint. It will be like a laser beam. You can do anything with this concentration. And see, time management to apne aap se ho jata hai. We used to do wealth management, business management, but nobody has ever taught us how to manage our mind. ना तो हमको स्कूल में सिखाते हैं, ना हमें कॉलेज में सिखाते हैं, ना हमें घर पे सिखाते हैं how to manage one's mind. That is the most important thing. So we'll do small practices today, how we can manage our mind. I'll teach you some small short pranayams, and I'll lead you into a short meditation of 5 to 7 minutes. But in the last, I will tell you, your mind, this is a verse from the Bhagavad Gita. Bhagavad Gita is a real practical source of how to manage mind, where Sri Bhagavan Krishna, he says everything about mind, how to do meditation, how one should live one's life. This is the chapter 6, 5th verses, which suggests your mind can be your best friend or the worst enemy. So we have enormous potential in our mind. We have to tap this potential by means of these practices. So I lead you into some short meditation, and first, before that, we'll be doing some pranayams also. So I'll teach you 2 pranayams today. 1 minute each. One is first is Brahmari, which is very important for calming your mind. There are two types of Brahmari pranayam. One is a simple method. You have to keep, this is the cartilage in front of the air, pinna. You have to keep your index finger over the pinna, over this cartilage, and we have to keep our spine straight, eyes closed. जहाँ भी आप बैठे बैठ जाएं, आंखें बंद कर लें. Keep your spine straight, head erect. Place your index fingertip on this small cartilage. Have a smile on your face, that is mandatory. Take a breath in and out. हम फिर से सांस भरते हैं और छोड़ते हैं. एक लंबी सांस भरेंगे और जाती हुई श्वास के साथ हमिंग साउंड करेंगे और धीरे धीरे इंडेक्स फिंगर को अंदर बाहर करेंगे, बहुत धीरे धीरे. टेक अ ब्रेथ इन. Again a breath in. फिर से सांस भरें. Relax. Keep your hands on the knees, palms facing the sky. Feel this humming in your head, forehead, and face region. Again, a breath in and let it go. Whenever you feel complete, slowly and gradually, with a smile on your face, you can open your eyes. It's good. You can show your hands like this if you are feeling very good, excellent. It gives me boost. Yes, it was good. Yes. Then another method of Brahmari is with Shanmukhi Mudra. Shanmukhi Mudra is what? Your little finger is below your lower lip. Ring finger is above the upper lip. On the L of the nose is middle finger and index finger is over the eyebrows. और आपकी जो थंब है वो वापस कार्टिलेज के ऊपर. सांस भरते हैं उसी तरह से हम हमिंग साउंड करेंगे जाती हुई श्वास के साथ और आंखें बंद रखेंगे. फील दिस हमिंग. सांस भरें. Take a breath in. फिर से एक बार सांस लें. Relax. दोनों हाथ घुटनों पे, palms facing the sky. और मुस्कुराते मुस्कुराते जब भी आपको संपूर्ण लगने लगे धीरे धीरे आंखें खोल सकते हैं. Good? Very good. Now we'll be learning one more pranayam that is known as alternate nostril breathing. A lot has been talked about from Dr. Raheja about the sympathetic and parasympathetic system. This alternate nostril breathing brings out the balance between the two systems, the parasympathetic as well as sympathetic. So what we used to do is with the left hand, the tip of the index finger and tip of the thumb makes a 0 like this, and the 3 fingers alongside it. This is known as chin mudra. Chin. Huh? This chin mudra will be placed on the left knee. Yes. Right hand ka right index and middle finger will be on the Agya Chakra. Agya Chakra is in between the eyebrows where we used to put bindi or tilak. Right thumb is on right nostril, remaining 2 fingers on the left nostril. The important thing is your spine should be straight, heart erect. Smile on your face, take a breath in with both the nostrils and release it with the left nostril. Take it with the left, hold it, release it from the right. Take it from the right, hold, release it from the left. Continue. Continue. Continue for two more rounds. And while exhaling from the left, you complete the round. Relax. Keep your eyes closed, hands on your knees. This alternate nostril breathing brings balances between the two systems. It increases awareness and it has a bearing over the hypothalamic pituitary axis. So all the endocrine related problems will be sorted out with this pranayam if done regularly and properly. Keeping our eyes closed. We'll sit comfortably wherever we are, on the chair, on the bed, on sofa, wherever we are. Keep our eyes closed. Take a breath in and let it go. Again, a breath in, deeper breath in. Fill your tummy, the belly is going out, and with the exhalation, the belly is coming in, touching to the spine. Again, a breath in. Fill your belly to its maximum. Fill your chest. And while exhaling, try to touch your umbilicus to the spine. 2-3 more breaths. With the smile, fill your belly, abdomen is protruding. Our lungs are expanding, clavicles are slightly going up, and while exhaling, clavicles are going down, chest is contracting, and our abdomen is going in. Do it 2 more times. सांस भरें, पेट फुलाएं, chest फुलाएं, and relax. फिर से सांस भरें and see off your exhaling breath like a guest with a smile on your face and relax. Become aware of the surroundings, whatever noises you are having, noise of AC, noise of fan, traffic, whatever the surrounding sounds are there, just be with them. Take a smile on your face. Become aware of your body. Relax your head, forehead. Relax your eyes, face. Keep a beautiful smile on your face. Relax your shoulders, the torso, and the lower limbs. Relax entire body. Take a breath in and let go. Every incoming breath energizes our body, and every outgoing breath relaxes our body. Just be aware of it. With this awareness, take a breath in, and with the outgoing breath, relax your body, relax your mind. Our body is like a candle, and mind is like a glow. Just become aware of 1 feet distance around you. अपने चारों तरफ 1 फीट के डिस्टेंस के प्रति सजग हो जाते हैं. Take a breath in and let go. Become aware of 3 feet distance around your body. Your body is radiating warmth. Feel the expansion. Now become aware of the space inside this room where you are sitting in. Expand more and more. Become aware of the ceiling and become aware of the space between your top of the head and the ceiling. Keep a smile on your face. Now become aware of the space above the city where you are in. यदि आप दिल्ली, गुड़गांव जहाँ पे भी हैं, उस शहर के ऊपर जो स्पेस है उसके प्रति सजग हो जाएं. Expand more and more. Become aware of the space over the entire nation. Become aware of the space over the entire Asian continent. Feel the expansion. Your body is radiating heat, warmth. Now expand more and more. Become aware of the space over this planet Earth. Become aware of the moon and the stars beyond it. Feel the expansion. Become aware of sun. There are so many solar systems like this in our Milky Way. Just become aware of it. In relation to the time and space, you are smaller than the smallest, yet you are bigger than the biggest. You're all pervading. Just be aware of the space over your city where you are in. Become aware of the space around your body. Become aware of your body and surroundings. And slowly and gradually, whenever you feel complete, with a smile on your face, you can open your eyes. I just want to know the state of your mind at this moment. You can write it in chat or you can speak it out.
It is very relaxing, ma'am. But now I think we have to take some questions.
Yeah.
Yeah. Okay. And thank you very much for such, a way to calm the brain. And so now I have some questions. I hope Dr. Deepak is available to answer few of the questions.
Yes, yes, he's there, Rajat, he's there.
Okay. Yeah. So, sir, there is a question that is there by Dr. Anil Taneja. That is how to deal with severe post-traumatic stress disorder and vicarious traumatization. So, could you just put your insight into this? Dr. Deepak?
I think he has to unmute himself. He is not audible.
Dr. Raheja, we cannot hear you.
Hello.
Yeah, now it's better. Please be a little loud.
Yeah. So I think it is very important that we look for signs in ourselves that we are heading for a clinical state which might require more severe intervention. But nonetheless, vicarious traumatization is something that we can only prevent ourselves. I mean, one of the key symptoms of PTSD and how it distinguishes itself from stress disorder is the avoidance. The avoidance phenomena in PTSD is very gross and very pervasive. I mean, a person gets so fearful that he or she will not want to talk about the disaster at all. To the middle part, in terms of how to protect ourselves. So now we don't want to carry this to extreme, but I think it is important that we, at least in the past or present or maybe for a future challenge, are able to restrict our discussions around the disaster, restrict our discussions around the pandemic, restrict at least some quantum boundaries in terms of how much news you are going to expose yourself to, which is talking about COVID all the time. How much you are going to expose yourself to events, how much you are going to expose yourself to memes and Instagrams and social media. It is extremely important. I think Dr. Sangeeta Saxena beautifully gave all of us a very invigorating experience. And I think meditations like these, which also fortunately in the age of technology today abound on internet and on YouTube. So if you were able to type something like what we call as the JPMR, which is Jacobson's progressive muscle relaxation, or you could type something like Yoga Nidra. If you could type something like auto hypnosis, if you could type something like safe space meditation or a calm space meditation, you will come across live guided meditation, something maybe not as beautiful as Dr. Saxena did live with us, but to at least give us some direction in terms of what we could do to attune our brain to generate the right electrical activity, because our emotions are a product of our thoughts. Our thoughts are a product of our neurochemicals, and vice versa. The chicken came first or the egg came first, the thoughts came first and then the neurochemistry changed, or the neurochemistry changed and the thoughts. So one of the key principle of CBT, which is cognitive behavior therapy, is that we try and change our emotions and we all continue to strive and fail miserably, succeeding partially, then going back. What really is the premise is that emotions are a end product of your thoughts. So thoughts come before the emotions and the behavior. And to be able to work and change your thoughts is much more easier than changing your emotions and your feelings. So if you can learn the process gradually of talking to yourself, striking the right work-life balance, limiting your exposure, learning to be mindful, to be movementful, trying to find small things to do. I mean, reach out to your friends, create a buddy system, create a system where you have at least a few friends where you can go beyond that stereotypical parrot-like I'm fine. We're all throughout the day saying we are fine, but are we really fine? Do we feel frail and vulnerable to acknowledge that we may not be fine? Is mental health such a huge issue where we are willing to be sensitive to all physical symptoms, but we are not willing to be sensitive to emotional, mental symptoms? All of us are humans, and I think it is okay to acknowledge that we can't be God. We should not try to be crusaders to our patients. We should not try to have godlike feelings. Let us understand our strengths and our weaknesses, draw a balance, and lead a more meaningful, calm life where your brain is vacillating in the right mechanisms. And I think if you can just go and maybe a little bit deeper, then our spiritual scriptures, I mean, whether Upanishads or the Vedas, they talk about certain very key tenet principles, which I feel have given birth to the Western psychology and hypnosis and CBT. Where you go in the West and do a session for a CBT, and you'll end up paying like $300, $400, $500 for an hour. I mean, that's huge compared to all the messages that are there. And I think one of the key messages that these Upanishads.
Dr. Raheja, sorry, can I interrupt? I'm getting some feedback from this attendees that your voice is very faint. Could you please come closer to the mic? Because
Yeah.
we want to
But
hear,
I mean,
but
sir,
we can't hear.
avoidance, creating a buddy system are predominantly the two key messages that you want to say.
Yes, yes.
And probably I will add to it that if you feel that you are a victim of it, please seek an early medical help. Don't delay an early medical help in these scenarios. So avoidance, creating a buddy system, and seek a medical help if you think that yes, there is a need. So thank you very much, Dr. Sangeeta, ma'am. The beautiful way for an online learning of the breathing exercises. Um, an attendee has asked about the name of the breathing exercises and if you could teach Sudarshan Kriya, but I don't think that the time allows us for that. But maybe we would love to have more sessions with you later. But meanwhile, can you just briefly tell about the name of the breathing exercises, one? And the second is that what I feel is sometimes it becomes difficult to create a balance between ambition and contentness. And that is the biggest challenge which the mind faces. So, I mean, if you can answer that and maybe the first question, then probably that is the big thing.
Yeah. Thank you, Rajat. First, the breathing exercises which we have learned today. First was the Brahmari Pranayam, which has a great calming effect over your brain and mind. Second one was alternate nostril breathing, which balances between the two systems, the parasympathetic and sympathetic, and it increases the awareness of the one's mind, and it has a bearing over the hypothalamic pituitary axis, thereby it has a bearing over the endocrine system. So it balances what we have a Surya Nadi or Chandra Nadi in the Vedantas, and it causes the balance between the two. See, beautifully these days, a lot has been talked about that vagal stimulation. And vagal is nothing, it's a parasympathetic stimulation, what our earlier people, the ancient people used to do to reduce their BMRs. That's why they used to keep in that very state for a longer period. So this knowledge is very ancient and very appropriate for this moment also. And at the time of COVID and the post-COVID state, once we are into the, as Dr. Raheja was saying, so much of the post-traumatic distress, post-COVID distress is there, PTSD is there. these practices will help you in calming down your system, in calming down your mind, and thereby leading a beautiful life. As far as the Sudarshan Kriya is concerned, it can be taught in the courses. We are having online courses going on every day. So you can link to the courses and you can take the online courses for the Sudarshan Kriya. It's a beautiful course. And I tell you one thing, whenever you will take Sudarshan Kriya, you will repent. Yes, repent that why you were so late in taking this Sudarshan Kriya. It's a beautiful thing happened for the mankind.
I completely agree, ma'am. Yeah, I think when I learned Sudarshan Kriya, that is the same thought that came to my mind, that I should have done it probably earlier. Yeah, so thank you very much for this insight, ma'am. So now I would like to invite Dr. Shalini to thank all the speakers.
Yeah, thank you, Dr. Rajat. First of all, I would like to invite Dr. Anjali Prakash to confer a certificate to Dr. Deepak Raheja, the first speaker of the session. I'm just sharing my screen for the certificate, please.
Thank you, Dr. Raheja. It was a wonderful talk, and your insights are very helpful to us. And I'm sure we will be calling more on you for help in these times. It is my privilege to confer you this certificate of participation. This is a small gesture on our part. Thank you very much, sir.
Thank you very much.
Delhi State Chapter.
Thank you very much, ma'am. Thank you, Dr. Raheja, for being here. And I must remind the audience that we got a session from one of the best mental health specialists in the city, and not just in India, abroad as well. And it was all for free. So you can donate that amount to Delhi RI to help our people and put it in our fund instead. And I think the same goes for Dr. Sangeeta, ma'am. I would now like to ask Dr. Shivani Mehra, ma'am, please, would you like to confer the certificate to Dr. Sangeeta Saxena for her contribution today evening?
Yes, thank you, Dr. Sangeeta, for such a wonderful, relaxing meditation session, and for teaching us those breathing exercises, and making us understand that we must take time out to relax our mind and not just our body. Thank you. And we really enjoyed the session.
Thank you, ma'am. Once again, I would like to thank all the panelists and most of all our attendees who have been diligently sitting through the entire session. I think it was a very successful session, the first of its kind that the Radiology Association of Delhi held in many, many years, because we only have academic sessions, and our mental health and well-being is as important for us as our well-being is in academics. So I think it was a wonderful session, and thank you all for being here. I would like to leave everyone with the next session, which we are going to have next Saturday. That would be on MSK, and it'll be taken by two speakers. That is Dr. Nidhi Bhatnagar and Dr. Nafisa. So we'll be starting with our next academic series next Saturday. Please make sure that all of you are here with us. Once again, I would like to thank all of you, President Dr. Anjali Prakash, ma'am, Dr. Shibani for next year President, and Dr. Rajat, thank you so much for joining us. He's opening a new hospital in Bangalore with all his contribution to the pandemic. So he joined us there from Bangalore, and thanks to everyone in Delhi RI who always make all these classes possible for us. Thank you once again to the speakers on a Saturday evening. Thank you for being with us.
Thank you. Thank you.
With that, we come to the end of the webinar. Thank you all.
Ma'am. Thank you, Shalini. Thank you, ma'am.
Thank you, Anjali. Thank you, Shalini.
बहुत अच्छा था मैम आप.
Thank you, ma'am.
मेरा तो चेहरा ही बदल गया उसके बाद.
We are not giving time to ourselves, basically.
Yes, thank you, ma'am. Thank you so much.
We have a lot of good feedback from our attendees, Dr. Daneja, Dr. Mala, Dr. Manchanda, Dr. Alpana ma'am was here. We have a lot of Dr. Parmeshwar, and I can see a lot of attendees. I think we had a great session. Thank you, everyone. This was very good, very much wanted. Thank you, ma'am.
Okay.
Thank you, ma'am.
Thank you. Bye-bye. Thank you.
Bye, Dr. Shibani.
Thank you, Shalini. Bye.
Bye, ma'am. Thank you.
Bye, ma'am.